Good. Thank you very much for that kind introduction. I think it's important because I'm very privileged to be here because I'm not an educationalist at all. I'm just a dermatologist. So I see people with skin conditions. I have no training in medical education except for the training that I was provided by the University of Stellenbosch as being a lecturer here. So I feel very privileged and honored to be here today. So just want to see that this is working. Oh, I must absolutely switch it on. So I think when you're a doctor, you're trained as a doctor and not as necessarily a teacher. And if you work at Tygerberg Hospital and you work in a busy clinic and you're the head of the department, you have a lot of functions to fulfill. And that's why I always say you have a lot of balls in the air. You always need to do service delivery, see a huge amount of patients. We do administration, as you know, from the university side and then from the government side. We have to do outreaches to Visser and Paul and Kailicha. Then we have to do teaching and we have to do research. But I would like to see this as you are juggling those balls the whole time. Most of these balls are made out of rubber because you know how to juggle them. And if you miss a little bit of service delivery and administration here and there, they just jump into play. But the problem for us as clinicians is the one special ball, and that's teaching, because that's a glass ball. As soon as you drop that, then it's broken. And you need to spend a lot of energy specifically because you're not trained for that. So I think that is the main purpose from this talk today. So I just want to give you a little bit of background about dermatology teaching. It's maybe important even if you visit your GP one day, what dermatology were they taught at the university. So we basically have about 4 weeks. 2 weeks where we have class lectures. So 2 weeks are dedicated where we tell them about skin diseases and give them lectures and so forth. And then we have 2 weeks where they visit our clinic. So that's the more practical experience that they will get. So 2 weeks of lectures and then 2 weeks of their clinical rotation. That's all of dermatology education that a medical student will have. So, so what did we do with all these lectures? When I came about 9 years ago to the university, we had these huge lectures that would work out according to a textbook. And we had to give these lectures in that 2 weeks divided by all the lecturers. So the problem is with 40 lectures, you have 40 lectures that you have to give, and we divide them by all the people that work in the department. But a lot of them are registrars, most of them. And they only are here for 4 years while they're specializing in dermatology. They're not necessarily dedicated to teaching and so forth. So you give them a few lectures, and then I looked at the feedback. And the feedback was always a little bit mediocre. And it was mostly due to the teaching from the registrars and some of the other consultants that was probably not in a very good way. So I was a typical strategic, so every year I changed the lectures that were bad, I was giving them as well. So in the end, I was ending up giving 40 lectures because I wanted to have this good feedback, and there was always a lot of this, and this one is not good, and that one is not good. So I decided, look, let me give all this 40 lectures by myself, which was fine because I will show you this, I think it was 2013 feedback. And again, when I arrived here, I didn't know how to read this. I just eyeballed it and think if it's more than 3 or 4, then I'm happy, you know. So I just go and more or less, so that was more or less what we were getting. I mean, that was in 2013. And then you look at the feedback, what the students write. That was a little bit more nicer for me. And we really, after I was giving all these lectures, getting quite good feedback. You will see a few things. We are eager to learn, and in the right environment, we understand, absorb so much more. The lecture was enthusiastic. It was easier to understand. So these lectures were basically worked out and given in a standard method. I will go to the next one. Just a few to say, hy by die klasse aan wat belangrik is vir GPs. So that's very important. If you give a lecture, always make them feel, look, this is something important to learn. And also not on a specialist level. So obviously that I got right. There was, I like, unbelievable how students can write. I can't even understand everything. His forthcoming in the relevance of topics is outstanding. So obviously that's irrelevant. His enthusiasm is infectious but well moderated. I like that. More of our lectures to learn. Okay, one that screams relevant to us as a GP and not a specialist. He told us exactly what was relevant in the information in an interesting manner. Thank you. So I think that was coming out from these lectures. I think I will show you one more. It was concise, yeah, and he's got new respect for dermatologists. So I think that was also nice for the discipline. So The thing is, I always say, when I ever feel bad about myself, I go back to that and I read it and then I feel very good. And that is probably all it means. You know, you get a lot of positive feedback and you feel very well, but is this the best way to actually teach the students? Because it's almost based on the way that I give the lecture, but not really on how they learned in a way. So obviously I was convinced that these PowerPoint lectures that I basically worked out in the few years was good enough. But is this the best way to actually convey this message? And is this the best way that students could learn? Just for a good feedback. And that was, as you're reflecting on what you are doing, I was asking myself these questions. And one of the questions was also, will I be able to continue this 40 lectures for the next 25 years when I'm here? And the answer is probably no. You can't do this. It's nice for the first few years, but then repeating the same lectures over and over again, this just can't hold. My voice was gone after the 2 weeks. So the problem is exactly that. Is this formal lectures, the way that we teach, is that the good thing? Does it encourage self-directed learning? Is it labor and time it was too labor and time intensive? And some students, as you know, don't attend lectures. So you actually you miss that group of students, definitely. So I was looking at this, Student Perceptions of a Flipped Classroom by Graham Brent Johnson. It was part of a master's degree. And I will show you what he said. There was 3 major findings. Students doing less homework in a flipped classroom, so that's good for the students, that in traditional based learning. Students enjoyed, so that's another thing, in the environment, and students benefited from watching these lectures. So I also looked at the dermatology literature. Was there anything that I could find on type of video instruction-based things? And this was a computer instruction that they just compared to learn students certain terminology on a digital basis, and then they asked the professor of the department to give that same lectures. And in the end, you can see, within the limitations of this study, computer-assisted instruction is at least as effective as traditional learning. So, although the one was not necessarily better than the other one, it's the same, you know, in a way. There was another nice article. This is from the American Dermatology Society, and they have a very nice online platform for anybody to learn dermatology. And they just compared, again, traditional instruction versus this, and they also find exactly the same. But what I like is that this core curriculum help educators teach dermatology to primary care learners without taking a lot of time out of their job to do the lectures. And that's part of it. I mean, you need to make your life easier as well. So what did we do? We basically took the lecture and we flipped it around. So that's the flipped classroom. I must be honest with you, when I started with this, I never knew there was a terminology for this. It was just that I thought, look, the previous years, that 40 lectures that I was giving, every time there was a student representative coming and press a play button and they actually recorded it. In the end, I thought, but now I have 40 lectures already recorded. So can't we use it next year? You know, that is actually how the whole thing started. What is nice in the way is those lectures were recorded in a classroom situation. So there's a little bit of interaction, there's a little bit of personality coming through. So when we will discuss that maybe a little bit later, in what formats can you actually do this? So a flipped classroom, what it basically means is what you would traditionally do in the lecture room, you do at home. And then what you will do at home, usually, you will do in the classroom. So what will happen is I will show them, I will give you an example in dermatology. So usually what we would do is we would have a lecture on psoriasis. And we would tell, okay, who gets psoriasis, how does it look, and so forth. And then we have another lecture on eczema, and we give a little bit of lecture on that. And then we have on acne, and those type of things. But now what we do is we say to the students, but it is there. Go and look at this lecture on eczema and psoriasis. And tomorrow, I'm showing you a picture of a patient with something red and scaly. And then we're trying to get to the answer, because that's what one day will happen. They won't come and say, doctor, I've got psoriasis. They will say, I've got a rash that itch. And now I must figure out, is it a fungus infection? Is it an eczema? Is it psoriasis? So it's a much more real-time experience that they will get. And the education on eczema and psoriasis, they can read at home, and they have the lecture in the same way that I gave it the previous year. So that was basically the formality of that. So we basically podcasted. We still kept our lecture book. We had our study guide, and we basically wanted to encourage integrated knowledge. The thing is, I gave them this is just a copy from that. I gave them good instructions on how to study these. Because if you don't give students timelines, in the end of the 2 weeks, they would have done absolutely nothing. So I would basically say to them, go through lecture 1, 2, 3, and 4, and then we will have a contact session. So at least 3, I gave them 1 day off. They don't have to come to class, or 2 days. And they can just look through those lectures in their own time. And then I asked them also to learn to think at certain concepts, like certain things that can make you worse when you go in the sun, or diseases that can make you itch. And those are the type of conditions that we will discuss in class. So maybe this it's just important to tell your students exactly the timelines, exactly what they need to do at home. If you don't do that and almost give them a little bit of a roster, they are going to miss the boat. And I've seen that in the first year. They get into the last few days and they've absolutely done nothing. And there's just not enough, even if they sit right through the night, to listen to those podcasts. So they must have a definite timeline. So the concept is that they will require their basic academic knowledge of dermatology at home, and then we will discuss patients, which is much more fun for me and for them there. And it changes from year to year. So did it work? So this you can see is a little bit of a feedback again. You will see, I like that one the most. I think that one, let me just go back. Dr. Visser reads a note. But you can see podcast and contact session, a great idea. This was the first time these students were exposed to this type of thing. I mean, it sounds, but it... And yeah, I suggest other modules should actually follow the dermatology technique. Dit was 'n baie goeie idee om podcast tuis te kyk, die tutoriale by aangedoen beter vaslegging van begrip. I mean, this is their own thing. I never tell them things like that. And it was nice. I mean, dit slag om eie tempo te pas te bepaal. And I think that's the thing is, students don't want to be in class at 9 o'clock. They sit in traffic, all those things. They sleep late. So they can start, if they want to start 3 o'clock in the afternoon and work till 3 o'clock in the morning, it's fine. When that they can't do with a traditional lecture. They need to be there on time. The contact sessions were also, and that is one thing that we found, that those contact sessions are still very important, and I will tell you about them as well. Very good idea to leave responsibility onto the students to watch podcasts. So that's again a self-directed type of learning. Watching podcasts at home is so much faster and effective, and it's true. I mean, you can make a cup of coffee and then you can go back where you were and so forth. And waiting between classes, we know that, especially between clinicians, they run late. And then they can jump in and they try to do the lecture and so forth. It also gives us time to go home and relax between studying, which I would think is also. Show you a few more. Really enjoyed it. Look, it's actually the first time I see high five, Dr. Visser. You see, yeah. And it's, I think this is more or less on the same thing. The podcast system work. There's another one about arrays. So the test results. The test is an online system, and it's exactly the same type of test format that we used. We use a clinical format, so actually I show them what we show in that integration sessions. I give them a picture of a patient, and then I ask them a multiple choice questions. It was all the same. You will see from 2013 when I gave the lecture to 2014 till 2000, almost the same. So it's not necessarily that the one was giving better results. I mean, we didn't test this now in very, very fine detail. It's just a normal test that the patient. But there was no difference. So if you're scared that the students won't get the information, they do get the information. And they actually enjoyed the classes much, much more. And the integration of knowledge is also much more. Now, we'll show you, we made a few changes in 2015. Just a few things that maybe you can learn from me, which I did wrong from the beginning, is the language is very important. I told them from the onset, because that was still when we had Afrikaans, English, had to use both. So we had English and Afrikaans. I think I was biased more towards the English because there's always difficult for certain students in the class. But I asked them to just put into groups. If they listen to the podcast and you feel that you are uneasy with a certain language, just ask your friend maybe to translate you. So that maybe helps a little bit with the group. I think if we do it now, we will probably do everything in English and ask somebody to translate in certain things. But language, just tell your students in what's the instructional language and what way they can get to the right language as well. Technical aspects, I think that's more or less sorted out. I remember the first time when we posted all those lectures online and the students went on. then the whole system crashed. It was just too large for information, and they just got all those lectures. But I think those things have been sorted out. The system can handle it easily. And then this is another thing, is this is not for all lectures. You must make sure that it's probably not for a mathematical concept necessarily that you want to do a podcast. But if you just want to convey information, a podcast works very well. I mean, you can listen that, it's nothing. Are you going to do something more than that? You know what I'm understanding? If you can ask yourself the question, by standing in front of a room, will this make a difference to the way that the students will get the message? So if it is, then you can basically do a podcast other way around. And then again, I said it before, but the context sessions are very, very important to get the students together. But I find that you can then check on them to get the timelines. Did they fulfill this? Make sure that you divide the class into smaller groups. Make sure that you hear what they are saying, that you absolutely make sure that they did learn and they did work through the lectures. Otherwise, you get always a few students who just sit there. They can obviously not even come to the contact sessions. And unfortunately, those who didn't still got more or less the same mark. I just checked on a few just random checks. No research about that, but they still got good marks, you know. So obviously, but I think it was much more fun, and the interaction between students are obviously much better. And then you can't go away on holiday, unfortunately, when you have your 2-book box. You need to be there, and I always say to them they can come anytime to my office or email me during those 2 weeks if they have anything in between. And they do ask about lectures, and they actually, I use those questions that they send me per email to discuss again in the contact sessions as well, because it's obviously such relevant. I now used even the previous year's one, because you don't know what students actually want to know, and then you learn actually from it yourself. So it's very, very important. I just found that in that thesis I showed you in the beginning, this is actually a student feedback form specifically for a flipped classroom. So next year I'm going to use this. So it's just designed to ask students, do you prefer this? Do you believe you learned more? Do you prefer this in other topics? Do you like working in this? Do I learn? And so on. So it's a rating system, but developed. It's not perfect. You can actually make your own. But maybe the feedback that we get now from the universities is on a class-based system. So if you can put in a small little thing and you can even make it in a little research project for your own class. It's actually very nice to have a specific feedback form to see how you can fine-tune your own practice for the future. So we made a few changes. The first time we had a week and then a contact session and a week and a contact session. That was just not enough. So you have to do a few topics, a relevant topic. So build a theme, they watch it at home, and then you evaluate them or you discuss the things in class. And make it as interactive. You must never stand there. You must almost never stand in front of the classroom. It must be small groups. I put the registrars into different groups to lead that sessions, and you just walk around and so on. And they have pictures of, we just do pictures of certain conditions, and they discuss what could it be and how to further evaluate the patient and so forth. And you can also give them home a little, for every lecture, maybe a little bit of self-evaluation questions that they can already connect to what you are going to say in the future. And then we also made our groups much smaller, because we have 350, I think now, students in a classroom. It's a huge amount of students. But you can still, I mean, if you just do it in smaller groups, it is still very viable. So in summary, I think it is very important that whatever you do, make sure that you reevaluate it yearly, that you make sure that this is what you do is actually very effective, it is conductive for the way that you want to teach your students, and that there isn't an easier way to do the same thing that you can do. Rethink the whole thing about PowerPoint lectures, because a lot of these lectures you can really just do on a podcast session. I think even you will know with meetings nowadays. I mean, we fly all over the world for meetings. Why can't we just do Skype meetings? I mean, it's available, the technology is stable nowadays, and still we see how people, there's a lot of things we can just do with the digital medium which can have the same outcome. Use appropriate technology for your learning. I think that's very important. What I show you here is just one bit. I mean, just podcasting a PowerPoint lecture. It's not really something spectacular, but it's a small point. But make sure that the type of technology that you are using will be specific for your discipline. And I think that last one is probably the best, is combine methods. Don't use one method. The one method could be, so use a podcast session, contact your student, because that's one of the things I missed, is with 40 lectures, you almost build a very good relationship with your students. You learn to know them. They come to the front. You make jokes with them in class. And then when you do the podcast session, it's almost like the way that I did it. They almost knew something about me because they hear your voice and they know what type of jokes you make and so forth. But you don't know them. So that was one of the things that I feel was not that nice. But if you do context sessions in small groups, you can maybe get a little bit of that back. Just on that point, while I'm thinking about it. Obviously, you can do podcasts by sitting in front of your computer with a microphone or whatever and do the lecture there. That I think I'm too hyperactive. I will struggle to do that, to sit and say that lecture in a specific way. So the way that we did it by giving the previous lecture and that's podcasting it and using it again worked very, very well. There was just one thing you must keep in mind. When you point with a pointer while you're giving the lecture, remember, the students don't know where you're pointing. So if you do that and you know you're going to use that, use the mouse on the computer. That's just a practical point, that they know exactly where you are pointing, because now they listen and say, yeah, you see, that thing is this and so on, and they don't have a clue where you are pointing in that idea. But there's pros and cons for each of that. Obviously, a more academical lecture where you can do it in your own time in your office. But I think if you want to convey a little bit more, you can do it in a real-time class situation. You can do what you like. But I think combining contact sessions with these is probably the key to go. And I think the most important is probably for us to have fun. Otherwise, you will just get bored and you will hate what you're doing. And as I told you, I mean, it's not my primary job. If it's not something nice, I don't want to do it. I give it to somebody junior to do it. So I think all of you, it's not only clinicians, all of you with research and all your activities that you have to do, and teachers with school activities and after-hour activities, have such a lot of, and our family life, I didn't even bring this in, have such a lot of things to do. So make your things fun, make it definitely the best for you and your students, but also very effective time-wise to make it possible. And I think this, you will always see that so often you find that the students you're trying to inspire are the ones that end up inspiring you. Thank you very much.
Thank you, Willie.
Visser. You're right, I also go to the student feedback and the positive feedback to feel good about myself. If I want to get depressed, I read the negative comments. Sometimes we learn a lot from the negative comments. What are sort of some of the feedbacks, the negative criticisms that you can get a feel for a lot of students having the same opinion?
I think that's such an important thing. I sometimes now, when we get the student feedback, and I think you will do the same, I actually only read the negative ones. I scan through it and I only read the negative ones, and I look for a theme that comes through. There was a few students in that feedback that said they didn't like it, but it was one or two, so they say they didn't. One of the students actually said, but they came to me in a personal capacity and said, but father said that he's paying for money to come to class, and now there's no classes, and I was smiling at that and thinking, but it shows you that student's concept of a classroom is what we actually forced on them for years, that this is the classroom. But the classroom is much wider. The classroom is in your bed when you read. Your classroom is in front of your desk. It's when you walk out. It's when you go to the hospital. That's your classroom. And this physical thing, we must actually get out of, we could sit outside on the tree, under the trees and discuss patients, or go to a hospital, which is probably more appropriate. But the negative ones, so as I said, some just said bluntly that they didn't enjoy it. A few of them said that they wanted to have a more structured program. Some of them said more contact sessions. That's why we brought it in the next year, that we had more contact sessions. Some of them had problems with digital, with technical problems, but negative ones on the conveying of the message. There was very, very little. And most of them actually preferred the choice. But as I say, I mean, the students who give you feedback on that form is a small amount, from a class. And then the ones that were negative were actually very small. So, but I agree with you. I think that's the most important thing, is when you do this, and it depends also. I think if I did it 2 years prior, I would have got very much negative feedback. Students were then, I think it's this new school curriculums that get students more open. They're much easier to take new things on. I don't know what's your experience with the newer. There's a lot of criticism about them, but I think they're much easier to get a message. The easiest way for them is usually the best. So the less effort they have to put in is usually the ones, and you must make it fun for them. And I think that's probably why most of you get very good feedback, is because that you are entertaining lecturers. Because you give them, they like you, and so forth. But in the end, this is not necessarily the best way for them to go out there with a lot of knowledge about your subject. You agree with me? I mean, it can be the same, that's what we hope for, but it's not necessarily that. Anything else?
Pick up your groups. Say it's a class of 300 students and you sit in a typical auditorium. Is it spontaneous or organized before? How did they actually come together?
Yes, that was a very difficult thing. I thought, must you now try and get names together and so forth? So I didn't have an answer to that. So what I just did is they all come to class, and I just divide them in little groups geographically as they were sitting. So almost if they just turn to each other, the amount of students that you can maybe get into that. We had about 10 groups. So that's still a large group. You will see, unfortunately, in medicine, that's the one, they won't go into that. But the groups are getting so huge that we always will miss a few that don't participate, and you can get them. When I started 8 years ago, we had about 8 students in our clinical groups with a doctor. Now it almost gets sometimes to, it was 2 with a doctor or 1 with a doctor. Now we get about 20 students. So they get 5 or 6 with a doctor. So if you don't want to participate, you just stand at the back. I am convinced that you will go through 6 years of medicine not being spoken to if you just stand at the back the whole time. So that is unfortunately the problem. There's no more instructors, but there's much more students. So just on a physical basis, we just divided the big, because it's that huge classroom that we have at Tygerberg, and we just say sit together, the ones that reach. I don't think it's the optimum thing, and that's something I need to work on maybe in the future again, that they maybe go in their clinical groups, the people that they know. You also don't know who's coming to class. Unfortunately, dermatologist lecture box is very close to the Easter weekend as well. So a lot of them are going away for, it's a long weekend, and then there's 4 days, and they just go. So so even what I did is these contact sessions. Also, the things that I say there, I also podcasted. So for those students, so you see, my thing is, I don't mind then if you don't come to class in a way. I know some of us want to, but the student must be there. I just say, well, I don't think if they don't want to come, they will never come. What can I do to make it the one that don't want to come? What can I convey the message to him? And then podcasting that sessions. You can say, but now nobody will come. But it doesn't, at some other reason, there's always students who come to class. I think it's also because they see you as a role model. They want to be there. Some of them want to learn. Some of them have different things. So they will always have that group of students that will always come to your class. And you use them to convey the message to the others. The message is more important, I think.
I just quickly want to make a comment on that. I just did a survey on the, we were running a project on podcasting in Afrikaans as well at Tygerberg. And one of the questions was whether podcasting can replace classroom, and 90% of the people said that classroom attendance is still very important.
And I can't agree with that more, because and I think in all of your disciplines, there is a way of mentoring. There is a thing of conveying a personality. In our discipline, it's important to convey profession, all these, what they call softer sounds, or signs, that is very important for a doctor to have. And the only way they get that is from the instructor. So you mustn't totally, but there's certain things that just want to knowledge-based things that you can just give them on a podcast. But a combination is the best.
First of all, thank you for the nice presentation. Also, I appreciate the fact that you underline the difference between good positive feedback and positive feedback, because we can be very good entertainers, but if their students don't learn that, it's a pointless positive feedback. Then I wanted to ask you, I'm not sure if you mentioned about assessment in this kind of, system. What was the assessment in your
So
case?
basically our assessment in this is, again, if you assess, you must obviously assess what you taught the students and what you actually eventually want the outcomes. And this was a much easier system because we tested that outcomes all the time, because we want a clinical picture and then, questions about that. So, and this is exactly what we did when we had the small group discussions. We gave them the clinical scenario and they had to work from there. While the other way around, we gave them just the academic lectures and then it made it quite difficult for them. So the assessment was a digital assessment with multiple choice questions with a clinical picture and a few questions about it. So, and that is more or less what we want. We want the patient, the student to see the condition, think what it could be, and have an idea about how to treat it and so forth. So we would give them a picture of a red scaly thing and say, we scraped it and we find a fungus, what's the diagnosis, or whatever. I mean, that sounds very simple, but that's the other thing I also want to say about podcasts, which I didn't say, is the quality of your PowerPoint when you do it must be excellent. Otherwise, it's even boring. I'm sure that you would have listened to a few podcasts that it's even worse. I will rather listen to a bad lecture when somebody is standing there, because you can speak to your friend and you can WhatsApp or whatever. I mean, but if you sit in front of a boring podcast, you must first make sure that the PowerPoints that you have, that you want to give, will be so nice for the students that they want to go home tonight and listen to those things. And I think that was why my starting point of having good lectures already. That was the basis. But that's why I think it will be very difficult to make an excellent one if you just sit in front of your computer and conveying the message in a way. There must be, or you must willingly make it so nice for them that it must be like a little TV recording of a nice thing that they want to go and watch. And that's a challenge. I mean, I'm sure there's a few very boring ones from mine as well, but you need to make sure that they want to listen to the things. Otherwise, it's also not nice.
I have a few things. Okay, I have a few things that I want to ask you and just mention. The one is the fact that you were comfortable not to be in charge of the students' learning. It was okay for you that they are in charge of their own learning. And that brings me to the two concepts that we have in education. You will hear we speak a lot about the pedagogy, which is the art and science of teaching, but specifically a child. And then we have andragogy, which is the art and science of teaching an adult. Now, our students are neither children nor full adults yet. And I think at the moment there should be a new development on how can we support the students to make the shift. And I think you've started that process by firstly allowing the students to take responsibility for their learning. And they seem to have been fine with it. The second thing is that there's only 24 hours in a day. And at the moment we have these champions like you, champion this whole flipped classroom and blended approaches and so on. But as time moves on and more become good at it, then we sit with another problem. So I think there will be a new research area. Somebody will have to keep an eye on this because we can only do so much. And then the other things, we had a visiting person from Belgium who specialized on multiple choice questions. And I think I will send you, or anybody who's interested, her PowerPoint presentation on how to rate multiple choice, because that in itself is quite a specialized area.
Yeah, assessment is extremely important. And maybe sometimes we must start with our assessment, is how are you going to assess your students, and then building how are you going to get that knowledge to them, and then think what building blocks can you do to get them to to get to the assessment in the end, because students actually just want to do good in their assessment. So if you can make sure that what you assess is actually what you want them to go out with, and use certain building blocks and not only podcasts but contact sessions and so forth, then I think it will be a nice way of getting to the answer.
I've got a more technical question. I'm also always on the technical part. The podcasts, are they on the internet for the students, or how do they access them?
They're
On Sunday.
Yeah.
Do you have any problems with students complaining about using their data?
I didn't. I didn't that somebody said, look, what I usually tell them is go to Gerga and download all the things onto onto your USB, and then you have all your lectures. So for the first time, just go onto Gerga, but you can download it obviously at home, but it's going to be a huge file to download. So if you can use the university maybe to just download it all. I also think that one student download it and give it to 20 friends or something like that. But I agree. I mean, that is a technical problem to think about, large data.
Alex is a response.
To answer the technical question, it's not hosted on Sunday.
Oh.
It's actually on the FMH's pod.
Oh, you're right. Yeah.
Separate to Sunday. But students actually come to the guy that operates the site to download all Dr. Visser's lectures. Some of them download it on hard drives. You get guys that, here's my laptop, just load the stuff on. CDs, some people still using. And someone actually, was a student that came in last term. She wanted everything on the iPod because I listened to it while I drive to Boston. So
I went to the coffee shop and I heard my own voice somewhere. And it was somebody, it was somebody listening to the lecture. And I hate my own voice when I don't like it. But one thing that you also said, what was it's about? Yeah, that was one of the big things for me. Is when I decided I'm going to do that, I almost thought, but now they're never going to say how nice I am again, because, and again, then if you sit back, they think, but is it now about me or what? And you still get good feedback, because the way that I did it, they will still have a little bit of you in a way, because it's your voice, it's your way of doing, your way of presenting. But I think that that whole thing about you are here, and it was how medicine was taught. I mean, you sit at the feet of those people who were doing everything, and you just didn't even speak to them. You remember that old classroom with a body in the center, or they just wheelchaired this guy in and they operated in front of that, because that was the main guy sitting there, and he had all the knowledge. And this is not what it is. I mean, now students ask me, and I say, I don't know, go and read about that, especially the postgraduate students. There's a lot of, I don't know. I mean, you can be a dermatologist of only psoriasis and never get the end of the knowledge. Knowledge is just too huge. We are just the facilitator in getting to at least the amount that they have to know to help them as a general practitioner, or in the way that they need to in the working place, if it's mathematics or whatever. Any other question?
I'm very interested in what Moira said just now about handing control over. In medical science, do you actually sometimes leave out the podcast? In other words, the content is for the students to find. You don't give them the content, they have to find the correct content themselves. Or don't you ever do that in medical science?
No, we do that definitely. So I think in most, it again, if you that will sometimes, even if we, or maybe put it like this, is the best way is actually what you say now. Unfortunately, if you have 2 weeks, then it's very difficult to build a whole curriculum on that principle. But it's important. That's why I always say bring your phone to the hospital. But as you are seeing something, Google that, and I will show you what websites to use so that you can find the knowledge. Because I see patients every day, and I'm Googling the whole time. I don't know the interaction between the 20 drugs that this person is on, and I've been a GP a long time ago. I don't even know the new antidepressants, and now they're on this 20 new antidepressants, and I must prescribe something new. I don't know the interaction. So that's a very important point, and I don't think we do it enough, so that we guide students to actually be able to know what to use. I mean, as a patient, if you just Google a condition, you get the most horrific answer because you're not guided to what knowledge to use. So if you know a few good websites to go to, you will get much better detail. And as we want to do it, I think what you are saying now, I'm going to make a note again about it, that we spend more time on asking students to find the knowledge more, and that you maybe build in the end of those podcasts maybe something, and even your contact session, how to find knowledge. So we only teach you as a GP to treat the condition up to here. I sometimes draw a line and say, this is where you end. But if you want to, if you have a way to find that extra knowledge. So I think guiding in finding knowledge is part of it. And we all have mobile devices, and they all have things, and iPad or whatever. And if we can guide them how to get the information, I think will be the ideal. And I must actually say it again when we have an educational forum, because that's very important.
I suppose in health sciences you have students with a specific profile, but I was just wondering, how do you check or ensure that students in fact do the work before the class and in the group work that they don't fake it?
Yeah, I totally agree with you. There's definitely some, I think, when I once talked about this at the academic year day, then somebody came to me and said, we actually have a platform whenever the student log on, you can actually see how many times they watch. Can we see it with our system as well? So you can, I've never checked it, but I think that will be a valid point. A nice research project will be to see the students that interact with a podcast, for instance, more. And because that's the other thing is, we give the block in April and they need to write the exam in October. At least they have all the information. They can just click on the lectures they want to re-listen. So I think you have to check. I think for most students, build in a control, but I think the university platform has that you can see how did they open it. And maybe you can call out their names, or send them an email and say, I see you haven't checked onto your thing. The small groups are difficult, because I just said mine is still not the ideal. There's students who can sit at the periphery who just never. What you usually try to do is when you have a group, to always pick a different one when you want the answer. So they must discuss, and then I will say, okay, so what did you and your group discuss? And then I will say, what did you and your group discuss? So that you randomly choose at least, and usually the people who sit more to the back, and when you walk through, you actually see they don't interact. That you can ask them to give you the feedback. But I think you can have even more nicer strategies, or if you sit together and think about how can we, but it is important to check on students, otherwise they won't do the work. And then when it comes to the assessment, then it's too late. And that's what we did in the first year. We struggled, because then it was, I get upset and anxious, and they don't worry at all.
I just want to respond to that. I think one of the things on Sunlearn, you can actually track someone's progress and also set your activities up so that they get access to the next one if they've done the previous one. You can also set up something called a progress bar. So you can select specific activities with timestamps if you want to. That, by this date, the student must have done this. And it can give you an overview of your entire class, saying how much percent they have completed of that course. But those are things that lecturers are doing in various faculties, and I think regardless of the faculty, there will always be that one or two, students within a group that is not going to participate for whatever reason. Maybe they know the answer, or they have done the work, but they actually just feel a lack of confidence, or have a lack of confidence for that. So what we've done actually is we've started a research project now that has been funded through Finlo. Within the faculty, it's also with about 400 students. We're actually tracking to see those that access it, what is the difference when it comes to the assessment, and to whether or not it helps those students who are struggling and that don't necessarily ask for help. So we have started researching it in the faculty. And I'm sure that it's happening in other faculties as well, or it's possible for us to do cross-faculty studies of a similar nature.
And online assessments. You can maybe say, work through lecture 1 to 5 and then do the online assessment. And then before they reach the class, that most of you must have, given in your assessment. It could be part of your class mark or some of your test point if you really want. But I think the technology that the university have available is actually amazing. I don't even know all of that.
I think we can take one final remarkable question. I think Stephen. Thank you.
One comment and one question. I've got a slightly different view on tracking students and whether they access and so on. We were talking about giving students responsibility. So I'm kind of If they access it, so what? If they don't,
That is
it's also not
that's
my
what I
worry.
also do, you know,
So I
but-
feel
but
kind of,
you can,
yeah, we should
yeah.
give them the responsibility and leave it at that. We don't have to track it. Maybe just one question on, how do you think your students are different after you've introduced the flipped classroom? Because, you know, if you look at the test scores, academically, based on that one test, they're kind of the same. So whether you've got a flipped classroom or not, it didn't make a difference. But presumably, and this is maybe, I'm putting words in your mouth, but presumably the way they learn is it's been different, and that's kind of valuable. And do you think it was worthwhile putting in all this effort to flip the classroom?
Yeah, no, absolutely. So that's part of the reflection. I mean, you do every day. Is now you look back and you say, was it worthwhile? Is there difference? I mean, the test scores are more or less the same. So obviously the way that they learned. So the one thing and it's very difficult to set it up to make sure, you know, how to measure that change. The one change I can measure is to see how they respond when they are then with the patient. And then hopefully that way that they learned will give them the critical thinking to get to an answer. You know, so necessarily the way or the academic knowledge is not always that important than the thinking process to get to a specific answer. Because in medicine and in most disciplines, you are usually in daily life confronted with a problem where you don't know the answer and you haven't got the knowledge. So that's why building on how to find that knowledge and getting, that's the ideal. So I'm still thinking of how we can actually make a little project and you know, see how the way that they learn more. The only way I can is just the way that how they interact with patients, which I do think is a little bit better. But as I say, newer students are more critical thinkers. They do tend to do that a little bit better. So yeah, so that's still the answer for me to answer myself, but I think that's the critical question. My feeling is all right, but you know, in science we hate that word feeling. It's like a boererat, you know. It doesn't mean anything, it must be proven. So we will think about ways how to put that into a project that we can measure that change that has taken place.
Wonderful.
Good.
I want to thank Willie. I just want to show you this book at the back of the room. You got, if you were at the SOTL conference, then you would have received one in this. I think we could cut this part out anyway. So if you haven't received one, take one. The reason I mention it is because this kind of real life experience that we learn from, and that we've learned from Willie today, you know, is so important, and we've built up some other examples as well from other disciplines. So just take one at the back if you can, and then I want to thank Willie on behalf of the audience, because I think, the notes I made, we've touched upon so many aspects of teaching learning in this three quarters of an hour. The idea of knowledge and the student voice, responsibility, assessment. We talked about alignment, we talked about technology, we talked about blend, we talked about so many wonderful things, and it was actually inspiring to me, and I think maybe the students are like that when you listen to you. It's like, I want to come to your class, I want to listen to you. So you are inspiring as an academic, as a doctor, as a teacher, and we want to thank you for sharing it.